Imagine trusting your life to a doctor, only to find out he might be the one putting it in danger. In France, an anesthetist named Frédéric Péchier is accused of poisoning 30 patients between 2008 and 2017. 12 of them never survived. Prosecutors say he did it just to play the hero by saving patients from the very emergencies he created. This is one of the most disturbing medical trials in modern French history. Who is Dr. Frédéric Péchier? Frédéric Péchier, now 53 years old, once had the reputation of a brilliant anesthetist in the city of Besançon. He worked in 2 private clinics and was often praised for his quick thinking during emergencies. Colleagues admired his skills, patients trusted him, and on the surface he looked like the kind of doctor you would want at your bedside. But prosecutors say behind that reputation was a man obsessed with drama, control, and recognition. How the alleged poisonings worked. The accusations are chilling. Investigators believe Péchier tampered with 4 bags before surgeries, injecting them with substances like potassium chloride, lidocaine, or high doses of anesthetics. These drugs, in the wrong amounts, can stop the heart in minutes. During what should have been routine operations, patients suddenly went into cardiac arrest. And nearly every time, Péchier was there, ready to resuscitate them. To his colleagues, it looked like he was saving lives. Prosecutors now say he was staging the emergencies all along. A pattern emerges. Between 2008 and 2017, 30 patients suffered unexplained complications under his watch. The youngest was just 4 years old, the oldest 89. In 12 cases, the patients died. In others, Péchier was hailed as a hero for stepping in at the right moment. But investigators say the pattern was too suspicious to be coincidence. Wherever there was a crisis, Péchier was there with the cure in hand. Victim stories. One of the most heartbreaking cases is that of a little boy known publicly only as Teddy. In 2016, Teddy went in for a simple tonsil surgery. But during the procedure, his tiny heart stopped, not once but twice. Though doctors managed to save him, Teddy suffered irreversible brain damage. His life and his family's were changed forever. Then there's the case of Sandra Simard, a healthy 34-year-old who went in for spinal surgery in 2017. Midway through the operation, she went into sudden cardiac arrest. Later analysis found her anesthetic bag had been laced with potassium, a lethal substance when injected into the bloodstream. Sandra survived after 5 days in a coma, but she continues to suffer memory loss and concentration problems. And not all were so fortunate. Families like that of Amandine Iehlen, who lost her father during a kidney operation in 2008, have waited nearly 2 decades for answers. For them, this trial is about more than blame. It's about closure, the investigation and legal battle. Suspicion first arose in 2017, when doctors noticed that Péchier was almost always present when patients collapsed unexpectedly. Toxicology tests revealed contaminated 4 bags. Péchier was placed under judicial supervision, barred from practicing medicine, but not imprisoned. Over the next few years, the list of suspicious cases grew longer. From a handful of incidents, prosecutors eventually tied him to 30 poisonings. By 2019, he was formally charged. The defense versus prosecution. Throughout it all, Péchier has maintained his innocence. His lawyers argue there is no concrete proof, no video of him tampering with bags, no fingerprints, no direct witnesses. They suggest these could have been tragic mistakes or even errors by other medical staff. But prosecutors counter with what they call undeniable patterns. They point out that Péchier was almost always nearby when things went wrong, and that he was often the only one who knew the solution in advance. A psychological profile described him as manipulative, controlling, even perverse. Some colleagues said he compared himself to Zorro, the masked hero who always arrives just in time. Hero syndrome. Experts say this may be a classic case of what's called hero syndrome. That's when someone deliberately creates danger or harm, only to step in and appear as the rescuer. In medicine, it can be devastating. A doctor, nurse, or caregiver may create crises just to bask in the praise of saving a life. And in the Péchier case, prosecutors believe that desire for recognition cost 12 people their lives. Other medical killers. This case also reminds many of other shocking betrayals in healthcare. In Britain, Nurse Lucy Letby was convicted of killing newborns in her care. In France, caregiver Ludivine Chambet was sentenced for poisoning elderly patients with sedatives. These cases, rare but horrifying, shatter the trust we place in medical professionals. What's at stake in this trial? The trial of Frédéric Péchier opened in September 2025 and is expected to last until December. If convicted, he faces life in prison. For the victims and their families, justice has been a long time coming. They want answers, accountability, and reassurance that hospitals remain safe places for healing, not hidden danger zones. So what do you think? Is this a tragic series of medical mistakes, or the work of a doctor with a dangerous obsession for playing the hero? This trial could be one of the most important medical crime cases in France's history. Let me know your thoughts in the comments below, and don't forget to like this video, subscribe to the channel, and turn on notifications.